Good afternoon. So we're here to talk about the Quality Working Group this afternoon. And can I just ask you to briefly introduce yourselves?
Yes, good afternoon. My name is Dr Paul Husselbee. I'm a GP and I'm Clinical Chief Officer of NHS Southend CCG or NHS Southend Clinical Commissioning Group.
Hi, and I'm John Stewart. I'm the Director for the Quality Framework at NHS England. My role involves really helping to build the national architecture or infrastructure for quality to support improvement across the system. For example, that involves making sure we have the right standards in place, the right measures, that we're harnessing the power of transparency, that we're using the right financial levers and incentives to really drive quality in the interests of patients.
So what exactly is the Quality Working Group?
The Quality Working Group was set up by the National Commissioning Assembly, 211 member CCGs in that, and the Quality Working Group made up of 46 people, both clinical commissioning group staff and members and national directorates from NHS England, all coming together in one group to put quality at the heart of everything we do.
And why is quality so important to us?
So I think we need to be clear what we mean by quality to start with, and I think in this country we are really lucky that we have a really simple and clear definition of what we mean by quality, and that definition really began and fell out of Lord Darcy's review of the NHS back in 2008, and for him it involved three component parts. Firstly, care that was safe, secondly, care that was effective, and thirdly, care that provided as positive an experience for patients as possible. And I think that definition really is powerful, because I think what it does is it begins to unite the ambitions of all staff working in the NHS with the hopes of patients and the expectations of the public.
And John, it's important to remember that for quality care, all those three components have got to come together equally. Without any one of them, it's not quality care.
Absolutely.
And how do we measure this quality though? How do you measure it?
So having a definition of quality is fine, it's a great start, but being able to measure how we're doing is absolutely key. And so the way we've done that is to really develop at a national level something called the NHS Outcomes Framework. And what that tries to do is fundamentally kind of articulate what we're striving to achieve for patients, using that three-part definition of quality as the starting point. So, for example, the first domain of the Outcomes Framework is around what the NHS is doing to reduce premature mortality. Domain 2 relates to improving the quality of life for people with long-term conditions. Domain 3 relates to how well the NHS is supporting people to recover from episodes of ill health. And then, of course, when we're providing that care and treatment, we need to make sure that, firstly, we are delivering that care in a way that delivers as positive an experience for patients as possible. So Domain 4 of the Outcomes Framework. And finally, that we, of course, keep people safe and they are protected from avoidable harm. Domain 5 of the Outcomes Framework.
And can you give us some examples of what the Quality Working Group has been working on in the last 12 months?
The Quality Working Group in the last 12 months has really done quite a lot of work in helping develop web-based resources, in helping develop tools, working with CQC and helping them develop the hospital inspection regime. So really done quite a lot of things over the past 12 months. But the really big and most important thing that we've done is help to develop the 7 ambitions that will form part of the strategy over the next 5 years. So those 7 outcome ambitions, and the Quality Working Group has been helping to set out how CCGs can set those levels of ambitions. And we've developed a how-to guide that 4 CCGs were used to develop that guide before the planning guidance came out, and that how-to guide was published with the planning guidance in December. And now what we need to do is help CCGs use that guide to develop those levels of ambition over the next for the next 5 years.
And Paul, I think that's absolutely right, and I think I wouldn't underestimate just how instrumental the Quality Working Group was in trying to firmly establish improvement in outcomes at the heart of this year's planning guidance, which will extend to the next 5 years, and the work around identifying the areas that we should set ambitions against.
Yeah, and I think we can be really proud of the work that we're doing.
So why is the Quality Working Group, why is that group so important to this?
I think the Quality Working Group firstly brings together a unique mix of people, you know, from different levels of the commissioning system. Clinical commissioning groups with those commissioning services at area team level, alongside those in the National Support Centre of NHS England who are responsible for, you know, developing some of the supporting policy and infrastructure. I think we've made a really great start. I think, you know, we've managed to get, you know, the focus on outcomes and outcomes-based commissioning firmly on the, you know, the agenda of both CCGs and NHS England. But I think there's much more still to do. I think we need to help bring about a real shift in mindsets. This is a very different way of thinking about delivering, you know, better services for patients. And I also think, you know, we've got a big task going forward to really understand what some of the barriers are to really kind of succeeding in becoming an outcomes-based organisation, whether they are financial barriers or otherwise. So, you know, a lot of work still to do.
John, I agree with you, but for me there's just really one important thing, and if we're to do the best for our patients, then we need to ensure that quality is at the absolute heart of everything that we do, and that's where the Quality Working Group can play a very important role.